Not only is Louisiana in the crosshairs of Hurricane Ida, the state is also dealing with an alarming surge of COVID-19 cases. Hospitals there are overwhelmed, and now the stress and pressure of healthcare workers are heightened by the natural disaster. One of the doctors on the front line happens to be the brother of our KCTV5 colleague, editor Cal Creek. Leslie Aguilar spoke with him for an interview you'll only see here on KCTV5.
To be honest, I think we're really in the thick of it right now.
Dr. Grady Creek is a Prairie Village native, currently hunkered down at a downtown New Orleans hotel.
It looks like the power just went out.
Creek and his family live in South New Orleans in a 2-story wood house. They decided this hotel was safer, but say it's still been scary feeling the giant concrete building shake.
You see some water coming in the door here.
Creek has lived in New Orleans for 8 years, working as a pulmonary critical care physician. Currently, his work consists of caring for COVID patients in the ICU.
It's been a hard month. It's a lot of people sick, and they don't need to be. You know, a lot of it's preventable.
He went from having 3 patients in the COVID ICU to about 60 consistently for the last 3 weeks. And though Louisiana's overall case numbers seem to have peaked then plateaued,
people end up in the ICU about 2 weeks after they, first test positive. So we're not exactly sure if we've seen our peak in the ICU yet. So the timing of this really couldn't be worse.
Many of the hospital staff are already overwhelmed at work, and now many have been forced to evacuate from their homes.
We're not in the best place. Our community isn't. Our doctors and nurses aren't. Everybody's burnt out.
Creek celebrated his 2-year-old son's birthday in the hotel room today while trees blew around outside. Tomorrow, he'll be back at work in the COVID ICU and hopes he won't have to worry about not having a house to come home to.
Once it's, safe and dry in our house again and I'm able to get my family back in, that'll definitely be a sense of relief. And once the numbers of COVID cases in our community really drop, that'll be a sense of relief.
Because even with the stress of the hurricane damage, he knows the COVID crisis will still be there tomorrow. He hopes sooner than later, case numbers drop back down to the single digits in the ICU.
When that happens, my blood pressure will go way down.
Creek says he knows Louisiana is going to need a lot of help in the coming days and weeks. His hospital was already hurting for nurses before the pandemic. He also says he cares about the Kansas City community just as much as he does his own home and recommends everybody get vaccinated against COVID-19. Leslie Aguilar, KCTV 5 News.